And on to our next guest here on Sports Medicine Weekly as we talk about the brand new Sports Performance Center at Midwest Orthopaedics at Rush. Dr. Chuck, you got to be proud of this in Oak Brook, right?
You know, Steve, we're very proud to open this center. You know, we see this as our ability to improve the performance of young athletes and also lower the injury risks. The science is there now, and I think we have the information on how to help our young athletes. And I think that's what our next guest is going to tell us about.
I haven't been there yet, so I want to hear all about it. Let's bring on Dave Heidloff. Dave is the manager of sports performance at Midwest Orthopaedics at Rush. So, Dave, hey, set the scene for us. As I said, I've not been there yet. I can't wait to go and view your facility. What's it all about?
Thanks for having me on. So I highly encourage anyone that's in the Oak Brook area to definitely take a look when you're at the corner of York and Cermak over in Oak Brook, and take a look at the beautiful new building that we have. On the first floor, you can see through the windows the sports performance area that we have with a full weight rig, every piece of sporting equipment that you could want. You can see our high-speed infrared cameras, force plates, everything that you would ever possibly want to analyze an athlete's motion and get them back to sport is present in our facility.
Go ahead.
You know, there's two things that we're looking for. Number one is performance, and then number two is, you know, Dave's ability and his staff to take an athlete who's undergone a medical problem, whether it be surgery or just recovery non-operatively for an injury. They're finished with physical therapy, but yet they're not ready to get back to their sport at a competitive level. And what we're trying to do, and I think what Dave's experience is all the concepts we do with our Division I college and professional athletes, we want to bring to our high school, our recreational, our young athletes, so they've got the same advantages.
Well, I want you to go into that a little bit more, Dave, on what Dr. Chuck is talking about, because I'm thinking physical therapy, and then what's beyond that?
Right. So what our staff is looking to do, so our staff is comprised of certified athletic trainers who are focusing on bridging that gap between injury and a full 100% confident return to sport. So we found that with some greater restrictions on visits from insurance and other things happening in healthcare, that there's this difficulty that people are having when they end their traditional rehabilitation and are trying to transition back to sport. So we want our patients truly performing on the field after an injury, not just returning to their team kind of guarded and fearful with some lingering limitations. By combining our rehab and performance training experience with the modern motion analysis technology that we have, we can actually identify and address any injury risks that a patient has, and we can help bolster their confidence and at the same time improve their performance. Like Dr. Bush-Joseph was saying, the worlds of sports performance and sports medicine honestly overlap a lot more than what a lot of people realize.
We're talking about the new Sports Performance Center at Rush. Our guest is Dave Heidloff, manager of the Sports Performance Center at Midwest Orthopaedics at Rush. I'm Steve Kashul with Dr. Charles Bush-Joseph on this Saturday morning at Sports Medicine Weekly. And let's talk about some of the services then, Dave, that you guys are offering at the MOR Sports Performance Center.
Yeah, so our most popular service is the Functional Sports Assessment, which is a whole body appraisal of strength, range of motion, and then we get into some sensor and video-based biomechanical analysis of athletic movements. Basically what that means is these assessments give us a head-to-toe idea of where you're strong, where you're performing well, and maybe where some deficits could be that we could address to not only reduce your injury risk or maybe help with some of the fear that you have getting back to your sport, but it's also going to help us improve your performance on the back end. So, like I said, these assessments help us determine our readiness for return to sport and identify some injury risk factors. We currently offer functional sports assessments for the hip, the leg, as well as the shoulder and elbow for throwers. We also have a standalone video throwing assessment. We offer a video gait assessment for runners. We also have blood flow restriction training and general strength and conditioning services. Everything that we do is developed to work around and prevent injuries. Some exciting stuff that we have is that if you're willing to make a commitment with us, we actually offer some discounted packages that are comprised of some functional sports assessments and then also some follow-up strength and conditioning sessions that will give you roughly 4 to 6 weeks of programming that can help you address your unique injury risk factors or, again, help you bridge that gap between where you're currently at when you end your traditional physical therapy and where you want to be confident back on the field, back on the court.
Yeah.
All of our services are one-on-one with a certified athletic trainer. We don't double book or anything like that. So you're getting one-on-one care the entire time.
David, I think what our listeners like, especially that issue, when the doctor says, all right, you're done, you're ready, you're okay, and the patient or the player isn't. And I think, the objective analysis and where you can really specifically point out, via video or via chart about where these specific deficits are, I think that really helps our young athletes. So, they say, I think I'm fine, but I'm a little nervous. And when you can point out, no, you're only functioning at about 65 or 70% on a given muscle group, I think that helps them. And so I think these are great services. This is relatively new. I think in the to our lay public, where we've done this for years and years, and our professional athletes where, quote, money was no object. But I think the cost of these services has come way down and really does make it accessible for all of us who are parents.
Guys, let me ask you, are they usually covered by insurance?
Typically not. I mean, this is that time. These are sports performance issues as opposed to treatment issues. And yeah, unfortunately, I think as David had mentioned earlier, no, they put the brakes on this. And so these are services that you're going to consider afterwards.
Great stuff. Hey, Dave, we're out of time. Really appreciate it. I can't wait to go see the Sports Performance Center at Rush. And your website is MOR.com?
RushOrtho.com/sportsperformance will take you to a list of all of our services as well as how to schedule. There's a scheduling button right there. You can book right on the website. It's really fascinating stuff.
Great stuff. Okay, out of time. Back with our staple of the show, Ask the Doctor, after this, only on Sports Medicine Weekly. You listen to 670 The Score.